part of looking at this every day, multiple times a day, is not just forecasting inpatient utilization and what beds we're going to need available to care for our surgical patients and our COVID patients, and just patients that are normally requiring an inpatient hospitalization. But one of the biggest factors we are facing right now is dealing with staffing based on the high percentage of people that are out from the workforce and being quarantined. We are seeing days where we have 19, 20 of our staff that test positive. We've had over 200 people a day out quarantined. This is having a huge impact on our ability to be able to respond to the demand for our services. So as Joe said, and I'm going to underscore, it is multiple times a day that we are looking forward at staffing, at surgical schedules, and making adjustments as needed with elective procedures. We're looking at the ED volume and what we can anticipate in terms of inpatient requirements as a result of that, and literally load balancing throughout the day. And I'm deeply appreciative to all of the leaders, our physician leaders and our administrative leaders that are working on those things every day. But being able to have the workforce to be able to accommodate this surge is a significant challenge, particularly, as I said before, burnout is definitely a factor. People are tired. And that is not unique to us. It's happening, throughout the nation. And so it's just something we have to continue to address. I'm going to see if this works. Oh, nope, wrong way. I'm just going to take a minute since it's 2 o'clock. I'm just going to take a minute to go through, I think, some of the forward-thinking strategies and ideas that we have. First and foremost, one of the things that has been just an absolute essential learning for us is that there's no question that a public health emergency requires a strong, formalized community response. And there are 4 levels of an effective community response that we focus on. The first is around personal preparedness. And part of that is educating the public as to what they can do to protect themselves, and also to create public policy that enforces those things that from a personal level are absolutely essential for someone to do. The second is around planning. And one of the things that has been very clear to us over the last 9 months is that if we hadn't already had pre-existing, well thought out, well-honed emergency preparation plans, we would have been at a just tremendous disadvantage. And so having the ability to continuously evaluate, modify, and improve those plans is essential for part of our future preparation for anything that comes our way. Third is around policy and partnerships. And we tend to think about partnerships as being within the healthcare community. Those are important. There's no question about it. Coordinating between the various different healthcare providers, from post-acute to home care, through all the various different hospitals in a market, is important. But it's partnerships with schools, it's partnerships with employers, it's partnerships with elected officials, with the state. All of them are essential. And the fourth is around public health policy and response, and that's an ongoing area that we have spent a lot more time than I would have ever anticipated that we would have to spend time on. In terms of preparedness, as I said, the continuous updating and and taking what we learn and putting it into the written plans that we have so that we can utilize that going forward is really important. One of the other things that is very clear in terms of future preparedness and this process of always being prepared for anything that comes our way has been in the area of supply chain. I think we have never experienced before a national breakdown in the supply chain of equipment and supplies that we need to be able to serve our community. And so that changes your thinking about inventory control and how you approach the supply management. And so we are putting some of these changing practices into place. The other thing that is really important for us is we've recognized that there are many other types of roles that experts in our organization can do in the face of an emergency. Staff on the ambulatory side can work in an inpatient environment if they have appropriate training and tools and mentors and facilitators. And we've learned a lot about that. But how do we keep continuously prepared for another emergency with that, the amount of work that is involved in doing that? You have to maintain deep data around who has what skills and where are they. And then you also have to think about ways in which you can continuously refresh their learning so that they don't lose what that they were able to essentially learn through the pandemic. How to support the psychological and emotional needs of the workforce, and things like daycare. When schools close and all of a sudden we have a significant percentage of our workforce that can't come to work because they have nobody to provide support to their children at home. These are not things we've dealt with before that are all being incorporated into our plans going forward. So as we look to the future, we're also thinking about what have we learned about the way in which that we provide care. And there's no question, we all know it, there was a lot of work that had to happen overnight in terms of how we transform care, particularly on the ambulatory side. So we literally, in 48 hours, were able to offer at first, it was not video conferencing through the Zooms and Blue Jeans and all of those tools. It was phone conferencing, but we were able to move to virtual platforms in 48 hours once elective care was shut down. We've learned a lot about that, and in fact, we've moved from that initial stage to what we call telehealth 1.0 to telehealth 2.0, which is just continual enhancements. But we also learned that we have gaps in all the services that we provide, that there are new, more contemporary models of care that can be a combination of in-person and virtual care that can really enhance what we're able to provide. And many of those new models and emerging models have the ability to both work in a pandemic or a public health emergency as well as work under normal operations. So we continue with our innovation team to look very closely at that. So there's no question that we have to continuously continue to work on preparedness. We are not of the belief that we will not have another pandemic for 100 years. We have to be prepared that we may be facing this again in the near term. The other thing is that there's no question, as you all know well, that in our community, a formalized community response is difficult without a public health department. That has been incorporated as an initiative into our strategic plan in recognition of how absolutely essential it is. And then I think the third just kind of closing comment I'd say is that we had no idea how difficult it would be to get people to comply with the basic public health measures that are in their best interest. And just the political nature of what's going on in our country today and how that has impacted compliance has made this very, very challenging. But we've learned a lot about public education and what we need to do in terms of repetitive messaging to try to get compliance. And all of those things are being incorporated into our plans.